Welcome to Withdraw Consent. I'm Victor. He's Jack. So we've heard a lot in the last few years about medical procedures concerning a certain outbreak. What about medical industry and how fair and whatnot they are with Americans pre-COVID?
Okay. Well, let's just talk about even during COVID, but not related to COVID.
Okay.
So first of all, I want to talk about vaccines. So we're not talking about COVID, medical experimentation. You make your own decision on that. Probably you already know things. We don't need to really go into that. But I want to talk about the regular ones because I had a baby recently and I was like trying to research it. I was contacting you about it. You were contacting a friend who knows about this. And the problem is the availability of the correct research materials, not very good. And so I'm going to put a link in the description to Joe Rogan, number 1999 with RFK Jr., 3 hours long. I would say worth every minute of it.
Especially if you have kids and that type of thing.
Yeah. Or if you're just curious about this subject that we're talking about, which is how awful the medical system in the United States is. But I just want to cover one part of his video. If you're thinking about vaccines and you're like, oh, these guys are weirdos, vaccines are good. Let's just talk about one vaccine.
Okay.
We're just going to talk about hepatitis B vaccine. Okay? Because got this baby, and it's the only vaccine that they want to give as soon as he's born. Okay? What does it do? Well, it protects your child if they do intravenous drug use with dirty needles or if they have gay sex. What are you talking about? And I'm like, no, that's ridiculous, There's no way.
There's zero chance those things happen.
Zero chance. Right. And so then what they're going with, well, if you have some type of blood-to-blood transmission with somebody who has hepatitis B, right? But then I get to watch this RFK. So I had the baby earlier. I didn't have the baby, And then I'm watching RFK Jr. afterwards, and I highly recommend you watch all 3 hours, no matter what you think of Joe Rogan or whatever, or RFK and the guns, whatever. But he talks about how the hepatitis B vaccine came. Did you watch this or no?
No.
Okay. And he says basically what happened is they developed this very quality, good vaccine that does what it's supposed to be. So all the gay people and the dirty needle users cannot get hepatitis B. It was a great vaccine, right? Okay. The problem is if you're using a dirty needle, are you going to go get your Hep B vaccine? If you're at a gay orgy, you're going to go get your Hep B vaccine? So nobody was using the product. It was a very good product to protect these two groups of people, but they didn't really want to go do it,
Okay.
So then basically what happened is the pharmaceutical companies who had spent all this money manufacturing this vaccine pushed the CDC and said, hey, why don't we mandate this for babies?
Gotcha.
And the CDC being completely captured, I'm going to put a video about agency capture in the description, by the pharmaceutical companies now mandated it. It's not mandated it. They put it in the prescribed vaccine chart. So now basically they needed to offload the vaccines. Your baby doesn't need the vaccine,
Right.
The vaccine may or may not harm your baby. I don't have any evidence of that. But your baby doesn't need it,
Right.
So there's nothing to be gained from giving to him. Anyways, I'll put the vaccine schedule up on the screen if you haven't seen it. But basically, you're supposed to get hepatitis B, 3 shots. You're supposed to get once at birth. It's the only vaccine you get at birth. And then you get a second shot 1 to 2 months later, which is probably your 2-month wellness exam. And then you get your third shot at the age of 6 to 15 months. Okay? So
is that the same schedule as an adult, Like if you never got your vaccine and you want to, partake in those activities where you could get Hep B? Okay,
no. So that chart I showed you is just for babies who are just getting dosed up. There's a separate chart on the same website. So if you go to that website, you can literally click the button and it says catch-up schedule, And then you could look at any one you want if you wanted to do it.
Gotcha.
So, and those are the ages, like I said, 1 to 2 months. It's not 1 to 2 months after. It's at 1 to 2 months of age.
Okay.
So basically, if you could just look with the critical eye at hepatitis B only and say, that's stupid.
Right.
Now do all the other vaccines. And I don't have the answers for you, and I'm not saying you shouldn't take all the other vaccines. I'm saying you should research it. But if you can look at one and say, oh, that's trash. That's trash. I'm not giving my birth, I'm not giving that little, you wild,
Well, you should crack the faith that you have in it, and maybe there's other issues here too.
Because if you're like, my doctor has my medical best interest at heart. Your doctor's following the CDC prescriptions. Does the CDC have your best interest at heart? Now, look at COVID. Anybody in this country think CDC? Yeah, there's some actually people at Starbucks right now with their mango lattes thinking that CDC is wonderful for them. You know what I mean? But they're not watching this channel, I'm going to guess.
Right.
And if you are, then just try to critically think of this. So basically, I'm not going to go into any other vaccines.
Okay.
I just want you to see, is this a compelling case to you? That you just want, like, should you look into it more?
To me, it totally is.
Okay. Yeah, my nephew just got four shots yesterday.
Wow.
And he couldn't play much because his arms hurt so bad. And I'm not talking bad about my family, but you've got to go research this because I don't know which ones. Maybe those good ones. I don't know. Maybe. But another thing I want to talk about vaccines is this. So what happens is you have a baby, and then if you're smart, what you'll do is you'll try to extricate your baby from the medical system and never bring the baby back. But you can't. Do you know why? No. When you check out of the hospital, they say, I kind of maybe heard a heart murmur. Come back. Now, look, if you don't come back and they hear a heart murmur, they can take your baby. Okay? If they don't hear a heart murmur and they say, do you want to schedule another visit? No, I'm cool. They can't take your baby. So they can't take your baby for not coming in for checks. But if something's wrong, they've detected something and you fail to treat it, you could be neglect, you know? So we come back, at whatever time. And it's a different doctor, of course. And the doctor checks heart murmur and he listens. He's like, absolutely nothing. Because there was nothing. You just wanted to get us to come back. And then my wife made this point to me. They do these wellness checks. And a wellness check is somebody who's not a doctor, checks your baby's weight, checks their length, right? Take the baby into the room. Then the doctor comes in, stethoscope, listens to the heart. And that's your wellness check. Now here's our vaccine pamphlets. They're just selling you vaccines and they're free. They're free.
Right.
Because they're just getting the money. Do you know what I'm saying? You're not even going to lose the money. You just got to pump this stuff into your kid. It's wild.
Right.
And okay, now we're going to talk about medical tyranny. Because I'm going to continue on the same story about that same baby, okay? And so we brought the baby in and they're like, okay, well, the baby's not gaining enough weight. Because there's this whole lie going around where they say, like, if you Google it, it'll say babies who are breastfed gain weight faster than formula-fed babies. In reality, it's the exact opposite of that. Several babies in our group were born right near my one,
Yeah.
And all of them, the moms failed on the breastfeeding. They got work and my wife stays at home, so she's succeeding. And all these other babies become formula babies and they're all just way plumper.
Oh, yeah.
Even sometimes maybe half the age are pumping out. You know what I mean?
Right.
There's a baby the same age who's 11 pounds heavier than my baby right now. The same age, same month right now. Amazing, and they're just chunky,
But your baby is also not skin and bones. It just,
right. No, he's healthy.
It's a normally proportioned kid that isn't fat.
Right. And these other kids are.
Yeah, it's incredible, the difference.
Right. And so basically what happens is they just want money, and they know. So with the baby, we're on insurance, and they just want money. So we come in and the baby gained X amount of ounces, pretty good. Could have gained a couple more ounces. It's a doctor who's a complete foreigner. And he says, yeah, I don't like this. I'm going to admit your baby, right? And my wife gets furious. She says, I'm calling my husband right now. And then he says, oh, no, actually, your baby's perfectly healthy. I guess we don't have to admit him. You just want the money from the insurance. You don't care about that baby's health. You don't care what I'm going to do to you if you try to take my baby. You know what I mean? Mm-hmm. You don't care about my... Wild.
Yeah.
Do you know what I mean? And he's just a complete foreigner,
Yeah.
Literally, they made us come back again because remember, they'll take our baby if we don't come back if they say the baby's underweight, And we specifically asked any doctor but that, or we're not coming. Got the same doctor. This time he was respectful because he realized, that we weren't going to put up with this medical tyranny, but it's wild, So there's that, my point is they're not working in the best interest of your child. They're just working for profits.
Right. You're not going to tell the math story? The ounces, and he doesn't even know.
Oh.
You have to,
I forgot. Tell that story. Yeah. That's the same foreigner doctor. Go ahead, do it.
This is just insane. So they go in, weigh the baby, and it's X amount of ounces per day or per week. I forget what the formula is. But based on the last visit...
It's 1 ounce per day.
Okay, 1 ounce per day. So they're expecting, if you haven't been here for 2 weeks, we're expecting 14 ounces of growth in your baby. And, they have the weight he was 2 weeks ago. They have the weight the baby is now. And the doctor's doing the math, and he's doing math as if there's 10 ounces per pound.
Right. The baby had weighed whatever pounds and 5 ounces in the previous one.
Yeah.
And so then the baby is now the next pound and 1 ounce. So he said your baby only gained 6 ounces because 5 plus 5 is 10. That's a pound, and then 1 more ounce.
Right.
When the answer is it's 16 minus 5 is 11 plus 1 is 12 ounces.
So he was just a little bit short of where he should have been, but this is the dude that's trying to prescribe like medical treatments.
He's trying to take our baby, which is not going to happen unless something serious is going down, but not for your fake stuff.
Like you're putting faith in people that understand things that little about even just basic math and measurements.
And these are when we go back to vaccines, these are the same people you're like, so like my sister-in-law, I don't blame her for giving the vaccines to my nephew. But imagine she went there and said, hey, give me your best advice. Should I get these? All of them. You know what I'm saying? These aren't your friends at the medical.
Right.
And the problem is with all this stuff being censored and stuff online, it's very difficult to find good information. And you need to have the right information before you put that aluminum in your kid's brain. Oh, wait, they just pee it out. You know what I mean? Because I was literally told that by the lady, and she's like, oh, we used to use mercury, now we use aluminum, they pee it out. Watch the RFK show. There's a study saying they checked the pee, it never came out. Then they went to look for it, and they split the monkeys open autopsy, and it was all in their brain. You watch the show, it's amazing. Okay, so let's go more medical tyranny, okay?
Okay.
I had this other example I'm going to give you, right? And this is, I poisoned myself accidentally.
Okay.
Ate food. I'm always risky with eating food that I shouldn't eat.
Yes.
Because I got an iron stomach. This time it didn't do it, but I didn't understand that I had been poisoned. And I was at work. I was in Kentucky. It was this whole thing. I couldn't work anymore, right? Had to go to the emergency room, and they basically just put me on fluids and they check me and they're like, oh, it's probably nothing, and they're like, do you want, narcotics or you want us to fix this? I'm like, I don't do narcotics, just fix it, I was there for like 4 hours in the emergency room, go to check out and they're like, okay, here's your bill. Your bill, it's going to be $625 for your insurance company. Or if you pay cash, it's $250. Or if you pay cash today, it's $200, So under a third of the cost if I pay cash, because they're just trying to milk the insurance company.
Right.
They give me these papers. This is our good faith estimate. Could be a little bit more. We don't know. And then boom, I pay them, And you got to pay the doctor separately. You got to pay the EKG guy separately. But basically later on, I get a bill from them, and they say, okay, now we have your final bill. That was just a good faith estimate. Remember, $625. $250 cash, $200 cash today. The total is now $3,000, right?
Okay.
With the 60% self-paid discount minus the $200 you've already paid, you owe $1,000. So they're saying, good faith estimate, you can get out of this for $200, not paying the doctor and the EKG, and now you owe us 5 times more, And if you look at the breakdown of charges, it says that just a level 4 ER visit is over $1,000 itself. So when they good faith estimate me $625 to insurance, it's a level 4, right?
It has to be at least 1,000.
It has to be at least 1,000. You go to the next thing and it's like all the hookups and that's like 500 and something. Like you guys, you know what I mean? Anyways, basically, I complained. I went to the government for help. Do you remember this? Yeah, I went to the government, found this website, called this lady, very nice. She helped me. Yeah, you can file a complaint if they excess charge you. End up filing the complaint. Do you remember how the story ends?
I feel like I do, but go ahead.
Okay, because I don't know if I told you the end of it, but basically I told him, and I'm like, this is the one time I've seen the government function well. The one time I'm impressed, Yeah. Then I get the response to my thing and it says, denied, here's why. This whole thing about not getting overcharged at hospitals doesn't include ER visits. It's only normal visits. ER? Oh, the one time I thought the government was coming through,
Yeah.
Well, eventually I fight this. I'm furious, And eventually they send me a letter saying, here's this printout, you owe us $0. And they said, we're going to use this as a training method in the future on how not to bill people. But imagine I wasn't a pushover.
Right.
Or imagine I had way more money than I had now. And it was, I'll just pay the extra $1,000. You know what I mean? I make, $900,000 a year or whatever. You know what I'm saying? This is a wild story, right?
Right.
They're just, it's a grift.
It totally is.
And what do you think, what's the likelihood of me going back to the doctor though? How often do you think I'm going to participate in the medical system for my checkups or my colonoscopy or preventative health? Do you know what I'm saying?
Yeah.
Because I know they're looting me. I got so many stories, but I'm telling you another baby story. So they were saying my baby was underweight, right?
Yep.
And the guy can't do ounces, So I'm like, oh, I'm just going to call a private practitioner. I'm going to pay out of pocket and I'm just going to get a wellness thing. Once that says he's well, I never have to put the baby back in the system, So I call and I talk to this lady and she's like, oh yeah, no, we're interested, wellness check. So imagine they're going to get the records. They're going to look at the records. They're going to weigh him, length, stethoscope. See you later. Give the baby back to us. Later on, they're going to say your baby's healthy or not. Later on, they're going to examine his charts, put together all thing. Easy, and they're going to charge hundreds and hundreds of dollars, I'm sure, to do this,
Yeah.
And I talked to them, and they're like, yeah, okay, put you on the thing, this and that. What's your insurance company? I said, I don't have insurance. And they said, oh, we're not taking new patients. You can't even get private health care if you don't have insurance because they can charge you triple at least based on my previous experience.
Yeah.
So I cannot get a wellness check for my child except for from the big hospital with the foreign doctor who doesn't know how many ounces there are and is trying to admit my child based on that. Right?
Seems good.
Should I tell another story?
Go for it.
Okay. So my mother, there's a personal story, but I'm going to tell you, my mother had stomach problems. So she went to see the doctor. She went to see the doctor. It was about 9 months later, she sees the doctor and they're testing, what's wrong with her stomach? 9 months later, they check to see if she has cancer. At that point, I don't know if she's late stage 3 or if she's stage 4 terminal at that point.
Yeah.
They killed her. The cancer killed her.
Yeah.
But if you know the deal, if you can catch cancer early, you have a much better fighting chance.
Yeah.
Much better. And it's just absolute and total negligence. You can say sue them or whatever. That's if somebody passes, it's a terrible thing. And but I'm just saying, this is our healthcare. So in my opinion, I would rather have like third world healthcare. Where they're like, hey, buddy, I'll really try to help you. I don't really know what I'm doing, but I'll try. I can't get that in America. You're going to actually attempt to do no harm to me? Just do no harm. Don't even fix me. Do no harm.
Yeah.
Can't get that in America. So if I could tie this into a bigger picture, right?
Okay.
The medical industry, the doctors themselves even are, I'm so glad I didn't go into medicine. They're trash. And not there's, some therapeutics guy who's never gonna, he's actually gonna help you with therapy.
Yeah.
But in a lot of these different fields, they're just complete trash. The brain surgeon obviously isn't doing this stuff. He's just fixing brains, But if you had a system that was working towards your best interest, if that's what happened, none of this would be allowed. There would be no advertisements for pharmaceuticals. The pharmaceuticals would be captured by the government and forced to do the best interest of the people. Right now, it's the government's captured.
Yeah, we're not talking about this government.
Yeah,
managing.
In this system, it's complete trash. But
Right.
in a good system, that system would literally force, and not just big lawsuits that, we'll pay you back $1 billion of the $7 billion we earned, like that family or whatever, however that happened. Anyways, so I'm just saying, it should be working for the best interest of the people, and it could in the future, right?
Yeah, seems like.
If we were to get rid of the system,
Right.
I seen a meme, and it was something like, if you own something but you're not allowed to sell it or get rid of it, you don't own it.
Oh, interesting.
Okay. And it had a picture of a car and it had like a for sale sign. It's like, nerp. Do you know what I'm saying?
Okay.
And it's like, this is a government of the people, by the people, for the people, and you can't do anything about it. You know what I'm saying?
Interesting.
You know that it's not yours because you can't, even though you just could quote founding father after founding father, it says just say no, just get away from it. Withdraw consent, in other words, you know? No, you can't. Wow. There's 3-letter agencies to stop you. You know what I'm saying? Well, your local cop will help them. The local comp will do it for them. They don't even got to. Anyways, basically, what do you think?
I completely agree with you. There's a stat I saw a long time ago. I don't have references, but I'm going to throw it out there. But we won't have a link for this one. That America consumes over 60% of the world's pharmaceutical drugs. Mm-hmm. And it's not because we're sicker. It's because all of the doctors are just peddlers for this stuff.
Right.
And so the people who are directly writing prescriptions, you're going through the people who, brain surgeon, he's a good dude and that type of thing. The people who are writing the prescriptions are the bad people. Or potentially. Like, statistically speaking, those are the ones that you should trust less.
Okay, I got another story then.
Okay.
Got the baby, And then they're like, kind of like, get out of the hospital the next day. They're like, everything's fine. Just go, Like, it was the next day. It was wild, I'm like, we're leaving? Yeah, okay, cool. And they're like, here, just take this oxycodone with you, right? What? Are you kidding me? You know? And so I go to the, like, you're in the, where they have the babies. I can't remember the wing. Okay. Well,
the maternity wing?
Nah, it's where they have the, I forget. And you go out and you, and there's like a whole nurse's station there, you know? And I go out and I say, hey, they're trying to put some oxycodone in my house, you know? And the lady, just her countenance changed. She's just a lady who works there. She's a nurse or something. And she gets angry. And she says, well, if you got a problem with that, you can go to the pharmacy and you can, what?
Oh, whoa.
And my wife's like, we're walking away. She's like, you better go in there and one-star these people. These people are awful. And we got a terrific doctor, though. You know what I'm saying?
Okay.
But they were furious at the backlash. The pharmacy technician was not. I went over there and I explained to him, hey, what else can we do? Because we don't want this addictive, you know, substance. And he's like, basically, I think it's hydrocodone. And he's like, I can give you hydrocodone. And I'm like, well, what's that? And he's like, it's basically just less narcotics, but equally as addictive, you know? And he's like, if not, we could just do ibuprofen, you know?
Yeah, there you go. I had a hernia surgery years ago, and they gave me, it was either Oxy or Percocet, or I'm terrible with the name of the drugs.
Did you take them?
I took one or two just for the pain.
Okay.
It was the worst part of the entire experience was being on that drug.
Yeah.
I mean, I immediately got off and was just doing ibuprofen.
Wow.
Way better experience without the...
I would be too scared to even try it once or twice. I'm over it. After all the stories you see, and, you know what I mean? It's just like poison. Like if I had to, technically.
Yeah.
But dang, you know?
Yeah.
Wouldn't want to. Yeah, I got an eye abrasion one time and they gave me codeine.
Okay.
And they were like, you have to take this before you go to bed because you're putting this goop in there and then your eye can't flutter, you know?
Oh.
And I'm looking at it and I'm like, I don't care if it flutters too much. You know what I'm saying? I'm not doing it. You know what I mean? And just never crack the seal because I'm cool. Like these people, they're trying to get you.
Right.
They're the bad people trying to get you.
Right.
And if you work in that industry, you may know about this, you know? I mean, lots of, like, I don't blame, my wife was in healthcare and she would never partake in this stuff. So there's a lot of different people in healthcare that don't.
Right.
And if you do, just stop being a terrible human being. Just stop working for the pharmaceutical companies, you know?
Right.
In order to make victims out of the American people.
Yep.
For goodness sakes.
Yeah,
That's what
sad.
I got.
So what are you guys' thoughts on this? Do you have any experiences or any stories like this of just wacky stuff happening in doctors' offices? We'd love to hear them. Any other ideas in this, you know, this realm of things with even not, this isn't really government, but it's just things being broken.
Right.
Yeah,
And captured.
Yeah, captured. Yeah, if you have any other ideas about that type of thing, we'd love to hear them. Always open to new stuff. We release new content Monday, Wednesday, Thursday, 8 a.m. Pacific, 11 Eastern. And we hope to see you at one of those.